Hello, this is Dr. Bouvier with Dr. New, and here to address an issue that's kind of interesting. When I was in intensive care unit, we used to get these calls from surgery about the little old ladies passing out and blood pressure diving down to nothing or so post-operatively. And a lot of it was because of adrenal insufficiency. And today we're talking about adrenal insufficiency. I've got a patient here that has a dizzy problem, lightheaded, kind of fatigued, tired problem, food intolerance, and some other things going on that just kind of sparked a thought here. And so we saw her last week, and she was a little dehydrated, and her systolic blood pressure fell like 15 points from lying to standing, and her heart rate went up by about 20 points. So that's either, and commonly, just dehydration, but it can be adrenal insufficiency. Let me say that again, adrenal insufficiency. And you have to kind of be aware of that with people who obviously had steroids, but also people who've been on hormones for a while, but also a lot of the psychiatric drugs can lead to adrenal insufficiency, and you have to kind of just be alert of the clinical situation that can happen. So with her she's rehydrated. There's no skin tenting. She's got wet mucous membranes, wet axillary areas, no sunken eyeball, no retraction, and she's got good hydration, normal specific gravity on the urine. And the difference between lying and standing blood pressure today was about 30 points on the systolic blood pressure. She went up by about 8 points. So you know that there's something else going on other than dehydration. Many times it's adrenal insufficiency. You see this a lot in post-op, and many times the elderly need it, but also other people like our patient here will need a little boost. So clinically, you look out for that. From the laboratory-wise, I always get an 8 a.m., somewhere between 8 to 9 a.m., 8 to 9 a.m. ACTH and cortisol level. That's ACTH and cortisol level. Even in lieu of normal electrolytes, you can still get a normal adrenal corticotropin, ACTH and cortisol. So normally cortisol and ACTH are high in the morning and then down in the afternoon. So we get between 8 and 9 in the morning, we get ACTH and cortisol, and then about 4 p.m., 3:30 to 4:30, we'll get another ACTH and cortisol within that same day. You can do a PM first and then AM, or the AM first and then PM. But it's important you get those two. Once you got that looked at, and there's kind of a flat level of both levels of both morning and PM, then you know something's wrong here. They're not getting that normal raise. Treatment-wise, we use Florinef many times because that's the mineral corticoid versus the glucocorticoid part of the adrenal gland. Sometimes we use Cortef, which is both mineral corticoid and glucocorticoid. So with you, we're not going to do anything right now other than check your blood pressure for the next week, both lying and standing in the morning and in the afternoon and evening. You're going to record them on a piece of paper, and we'll go from there. So I'll see you next week, and we'll make a further decision. Again, this is Dr. Robert Bouvier with Dr. New. We're talking a little bit about adrenal insufficiency.